All right, everyone, we might make a start. So hello and good morning, or good afternoon, depends on where you're tuning in from. I'm so excited to be facilitating this webinar on Dementia Action Week, and which will be looking at Dementia Enabling Environments for Falls Prevention. I'd like to thank everyone for tuning in today and taking the time out of your busy schedules to build your knowledge and awareness of the environmental impact of falls on people with dementia. Today I'm facilitating this webinar from Whadjuk Noongar country, and I would like to acknowledge the Whadjuk Noongar people, the traditional custodians of the land in which I'm tuning in from today, and pay my respects to their elders, past and present, and the leaders emerging. Australia always was and always will be Aboriginal land. I would love to know where you all are tuning in from today. So please do use the chat box to acknowledge the traditional custodians of the land you are tuning in from today. Before we start, I would like to go over a few housekeeping points. Can everyone please double check that their microphones are muted? This will allow everyone to hear the presenters clearly. We would love to hear from your questions, so we strongly encourage you to please send them through in the Q&A box below, and we'll go through them at the end of the presentation. If you have more than one person in the room with you listening in today's webinar, we would appreciate it if you would please send us a quick private message via the chat tab to let us know how many people are listening in with you today. If you face any technical issues during the presentation, please write them in the chat box and we'll do our best to help you. I have Joe helping me here today, who's my colleague. And also just an FYI, this webinar is recorded. A bit of an overview of what we're going to cover in today's webinar. We're going to look at dementia and its effect on falls risk in older adults. We're also going to look at the environmental risk factors, as well as the barriers and supports to movement for older adults with dementia. And finally, we're going to look at how you can help create supportive environments for people living with dementia. So a bit about Injury Matters. We are for safer people and places. Injury Matters aims to prevent and reduce the impact of injury within the Western Australian community. We do this through advocating and providing education for injury prevention, as well as providing support for people who have been impacted by injury. Today's training is brought to you by our Stay on Your Feet program with the support of the Department of Health WA. The Stay on Your Feet program provides information, training, and support to older adult community members and professionals working with older adults on how to prevent falls in the community. This is done through the Move, Improve, Remove campaigns, Move Your Body, Improve Your Health, and Remove Hazards. Before we welcome our speaker for today, let's have a look at falls in WA. Each year, 1 in 3 people over the age of 65 experience a fall. This becomes 1 in 2 people over the age of 80. On average, 1 Western Australian dies from a fall every 26 hours, requires an ambulance attendance for a fall every 19 minutes, is admitted to hospital for falls-related injury every 17 minutes, and attends an emergency department as a result of a fall every 12 minutes. There's a few stats on your screen there, but in summary, falls are a serious public health concern in WA. People with dementia fall 2 to 3 times more often than cognitively healthy older adults. They're also 5 times more likely to be hospitalized due to a fall. The number of older adults living with dementia is expected to increase dramatically in the next 15 years, and the risk of major fall-related injuries, such as hip fractures and mortality, is increased among adults with dementia. Therefore, older adults with dementia can be considered a high-risk group for falls. An understanding of risk factors for falls among this population is required so that healthcare professionals can develop effective falls prevention strategies to reduce the negative impact of falls on an individual's quality of life, as well as the economic burden of treating falls in their workplace or clinical setting. To continue this discussion, I would like to welcome Nick, our presenter for today. Nick leads the environments team within Dementia Training Australia, a government-funded organisation delivering a national training program to the workforce supporting people with dementia. The environments team focuses on ways in which staff can create more supportive environments through daily acts that remake a building, creating environments that support residents' orientation, their access to the outdoors, and their pursuit of meaningful activity. I'm going to stop sharing my screen now, but welcome, Nick.
Thank you, Apu.
Sorry, one sec.
Okay, so I'm going to start talking now, and let's just see that everything's working and people can see me. If people can see me clearly, if people can't see me, send something through to the chat. Okay, I've got somebody saying it looks good, so I can continue from there. It's a very strange world we're living in at the moment with Zooms and people working from home. So everyone feels a bit ungrounded. I'm going to say that I live and work on land of the Bidjigal and Gadigal clans of the Eora Nation in New South Wales. And I likewise pay my respect to elders past, present, and emerging leaders. So my name's Nick Seemann. I'm an architect. I'm the director of a firm that we founded about 20 years ago. And the aim of the firm was to find ways of supporting different organisations involved in social projects. So that was a lot of work with homelessness, work with other forms of supported accommodation and community buildings. And we kept coming back to an area that interested us, which was aged care. I'd been working with some interest in aged care since for more than 20 years, since undergraduate work. And through that work, we started to find that there was more and more of a need for us to work on improving buildings, improving existing buildings. I'll go through some of the statistics later on, but there's about 240,000 people living in residential aged care. And we know from research and evidence that's been research done over the last 30 years, that for most of those people, many of those environments, the environments are actually, they're actually disabling. So they're making things worse for the people who've gone to live there. And from that work, I became involved in Dementia Training Australia, where I now lead the environments team. So Dementia Training Australia, as you said, Apu, we're a nation-wide training organisation. We're funded by the Commonwealth Department of Health, and the different offices around the country focus on different areas. We're a consortium of universities working together with Dementia Australia under that broad umbrella of Dementia Training Australia. So for instance, in Western Australia, the team there focuses on medication management and looking at ways of reducing the use of psychotropic drugs in residential aged care. My team, which is based out of New South Wales, but we operate across the country, we focus on environments and where do buildings come into it. And I'm going to go into a lot more detail about that. But while we've got a very big focus on residential aged care, we also look at other environments. We look at independent living, and we're also focusing how we can support people looking at what's happening in their home. So that wider idea of how communities can support people living with dementia. I recognise that we've got a very wide audience today, and there will be people here who are working in residential aged care. And again, to just say, we know that many of the reasons that people move into residential aged care, somebody who might be likely to have a fall at home, or somebody who is lonely at home, or somebody who's disoriented at home, that many of those issues are actually exacerbated. So somebody moves into an environment which is unfamiliar and often is quite institutional, and many of the reasons why they've moved there, those issues are actually amplified rather than addressed. So our work is looking at how can we support those people once they've moved into what should be a caring and supportive environment, and I'll go through that as we talk today. So if you're working in residential aged care, I'll be talking to that. Seniors living, likewise, there's a high number of people living with dementia in various forms of retirement living, and very few retirement villages are set up to provide supportive environments to people living with dementia. And I'll run through that a little bit if that relates to you. In terms of homes and home modification, It's not an area that we usually focus on, but what I'm going to talk through today has broad application and application in people's homes. And often I'm approached by people talking about a family member who has a diagnosis with dementia and what can they do with regard to a home. So I'll be relating to that as well. And as I go through this talk, each point that I go through, I'm going to try and give you references to other resources and what we can provide you with, as well as other organisations. So a sort of mini agenda of what I'm going to look at is I'm going to start by looking through a bit of an introduction to the relationship between environments and two key issues: falls and specifically dementia. In both cases for older people, where does the environment come in terms of falls and dementia, and recognising that broad group that I think are here today, while I'll talk a little bit about what you can do when you're designing a new building or refurbishing a place. I'm going to focus very much on what we can actually do in terms of the daily remaking. So what happens on a daily basis when staff in an aged care facility or people working in somebody's home, what they do and how that impacts and affects the people living there. So having talked a little bit, when I've talked a bit about falls and dementia generally, I'm going to talk about three key environmental issues. I'm going to talk about managing environmental stimuli, people getting outdoors and exercise, and generally active lifestyles, and where the environment can support that. Now, before I go into the meat of the presentation, I'm putting up. I'm going to do a little icebreaker first. I'm putting up behind me an image of an image from a hotel. It's actually a cafe, a courtyard area in a hotel. And I want everybody to just have a look at this image and imagine themselves sitting there. And we're going to look at two images, and then I'm going to go into that first part looking at a bit of a background of older people and falls of people living with dementia. So firstly, just having a look at this, there's hopefully a scene in front of you that everybody can see. If you're having difficulty seeing it, please do send it through to the chat, because we've got ways of working around that. But if you can see the scene, you can see people sitting around a courtyard, lots of trees, and they're sitting at tables. I quite like this scene. It's not a photo I took, but I really do like this. And so what I'd like you to do is just have a look at that and see one thing that you actually look at now that you quite like, and just one thing that you like about the scene. If you don't like it, you can put down what you don't like. If you do like it, one thing that you like, and if you just throw that into the chat, and let's just see what people come up with there. So I'm just going to pause for a second while people write in things. People like the garden, they like the shrubs, they like the calmness of it all. Okay, and so then I'm going to go through to a second image, and let's have a look at it. The second image is a scene from an outdoor area somewhere, probably in Europe. It's a sort of scene which I've seen before. I've been part of many, many years ago. I was lucky enough to be in Italy during a big festival, and I saw a scene very much like this. Again, I didn't take this photo, but imagine yourself in this scene. Some people like it, some people don't, but let's just have a look at that and think through, what do you like or dislike, something very specific about what you're seeing in this scene. So people are looking at being crowded and noisy. I went to places like this, so when I was in my 20s and loved it. I reckon now, crowded and noisy, I agree. I wouldn't quite like it as much at the age of 52. I wouldn't like it as much as I liked this when I was younger. But for me, I put this up because I still like the scene, the sense of life and activity there. But I'm going to go back to the first one again, and now I'm going to ask you to think through the same image, but imagining the future version of yourself. So imagine yourself in 10, 20, 30, 40 years' time, or more, and think through, now what's it feel like? Let's imagine the 90, 95-year-old version of yourself sitting in this scene. How do you relate to it now? What's going through your head? What's easy? What's difficult? What are the things that you like? And again, I'm going to repeat the exercise with the other image. So again, looking at this one here, imagine the future you. What do you think about that? You're one of the people sitting here. You're the guy sitting over here, a few people in, or the person who's sitting over here. What do you now think about that scene? What are your thoughts? While you're doing it, if anybody isn't seeing the full image here, you might want to pin the screen. So there's 3 dots on the side of the screen. If you're not seeing it, click that and hit pin, and that will show you. It'll probably then cover your whole screen if you haven't done that already. Okay, so great comments coming through, and I'm going to go back and just talk a little bit about them. And the reason I wanted to do this was I think that in Australia, we're often quite disconnected from the places that we live. I've been in situations as an architect where somebody literally in an office was saying, this room is too bright, and I had to show them there was a blind they could pull down. Or other situations where light's glaring in somebody's eye and the light can be moved. And I think that for whatever reason, we don't have a very strong, I don't know if it's any different anywhere else in the world, but I know often we don't look at the places that we're spending time. And what I wanted to do here was just to start a process to say, well, let's look at this. What are we seeing when we walk around the place? What do we see in the environments that we're spending time in? So here, the things that I always look at here was that I like the fact that it's green. I like that it's green and shady. I like that at the age of 20, 50, 80, I think it works in all cases. The chairs, maybe I need a more stable chair if I'm older. Maybe the table's more beneficial if it's stable. But still, there's a nice spot that I could sit for a long period of time. It doesn't look rushed. I can actually see quite clear paths there where I can see my way around because there's vegetation around the edge of the paths. And where that fountain is, it's got a decent size wall on the edge of it. So I'm likely to see that. If I'm sitting here, somebody's probably bringing me a cup of coffee. Maybe I can see a toilet that I can go and use. So at different ages, it works for me. And when I go to the other one, it's many of the things people were bringing up in the chat. So looking at this scene was one that I liked at the age of 20. I probably still could enjoy it, but at the age of 85, it's starting to bring up other issues for me. Maybe my hearing's not as good as it used to be, and the noise and busyness are causing a bit of a problem for me. Maybe it's crowded, and the difficulty I have, if I've got any issues with mobility, getting into a spot where the bald guy with glasses is, it might be difficult for me to get there. If I've got problems with continence, I might be worried about how am I going to get to the nearest toilet. The busyness might be overwhelming due to a dementia I've got. So I'm experiencing a very different thing here. Now, throughout the talk today, when I use the term environment, I'm using it very broadly. So when I look at environments, I'm looking at a building, a garden, or the spaces outside, a deck, anything like that I'm using as the term environment. But I'm also going to talk about things like the furniture, the way in which a space is set up, the curtains, are the curtains closed or open? I'm looking at the doors to a building. I'm looking at noise as part of the environment I'm in. So all of our senses create the environment that we live in. And often we, I think, are so focused on looking at televisions and looking at something very particular in a very narrow frame of reference. It's really how do we broadly look at an environment, a space that we're in, and relate to that. Okay, so now I'm going to give a little bit of a background talking through why environments do matter, particularly for older people, people living with dementia, but to just do a little bit of background on falls and what we know. Now, we know that being older, having dementia, or living in a nursing home, all three of these are contributors to higher levels of falls. So whereas falls and fall-related injuries are common, particularly in people over the age of 65, we know that something like 1 in 3, a third of the population over 65, will fall at least once in a year. But that goes up a lot. So it goes up to a higher incidence. In nursing homes, it's something like 3 times the likelihood of a fall of somebody living in the community. And so we also know that people, depending on the statistics that you look at, people who are living with a diagnosis of dementia are more likely to have a fall. Some people talk about it being twice or even 3 times as likely. There's various different statistics. All the way through here, by the way, when I talk about dementia, I'm going to talk about people living with dementia. So I'm not going to talk about people who are dementia patients or a dementia person. I think it's important that whatever language we use, we're focusing on an individual. Tamar Krebs at Group Homes Australia, when she speaks about any residents that live in her places with dementia, she talks about people living beyond a diagnosis of dementia. In fact, I think that's a key thing. And Tamar says, and again, to just put that focus on, we're talking about individuals and individual experiences. She says, when you've met one person living with dementia, you've met one person living with dementia. So just to really, even with the language we use, to be focusing on, it's not the dementia we're focusing on, it's an individual and supporting their life. One of the other realities for older people and people living with dementia of a fall is a fall can have a huge impact on people's independence, their mortality, and institutionalization. So there's a reality that if somebody has a fall and breaks a hip, there's a high chance that that's going to mean that's something that they will not fully ever recover from. So the most common reason for somebody living with dementia to go to hospital is to do with a fall. So that accounts for something like 26% of admissions to hospital. And anybody who wants these references, I can give you references to the articles that I'm basing this on. So from a literature review, we're looking at that's the importance of us looking at falls is really clear. I was very lucky to go through some of this talk with Renee Mendez of New South Wales, from New South Wales Health, from the far western New South Wales, and her commentary about residential aged care was the majority of falls of people living in residential aged care in their district are happening when people are either going to or returning from the toilet. Mary Marshall, one of the big researchers and writers on dementia and design for dementia, once gave a paper in which she talked about a major place where falls happen in residential aged care is in bedrooms. So there are reasons why we need to really be focusing on falls, and there are serious repercussions. But there's a real problem, which is that in the literature there's a really limited ability to explain what the environmental risk factors are. So the idea, people have done multivariate studies where they're showing that there's a significant risk from, and you've got a list there, the reasons for falls will relate to a fall history or gait or balance and mobility problems. I'm just reading through that list there. The slides will be shared afterwards, but visual impairments, cognitive impairments, fear of falling, environmental hazards, muscle weakness, incontinence, these are all issues that can lead to a fall. And again, from Renee, there's a clear reality that institutionalization often leads to further frailty and further deconditioning of somebody. So we have all these risk factors here, but beyond looking at some very clear hazards, there's a lack of evidence that really looks at where does the environment come in. That poor evidence came out in a 2018 Cochrane review. I'll just change to the next slide. So that review that I've put up there, that 2018 review by Cameron and his colleagues, actually it was quoted saying, "We're uncertain of the effect of exercise on the rate of falls, and it may make little or no difference to the risk of falling. General medication review may make little or no difference to the rate of falls and falling. Vitamin D supplementation probably reduces falls and the rate of falls, but not the risk of falling. And we're uncertain of the effect of multifactorial interventions on the rate of falls. They may make little or no difference to the risk of falling." Other studies have also shown real difficulty in looking at, in trying to explain that connection to the environment and falls. And I guess what I take away from that is that there is literature on things like screening people. There's literature on correlating falls to certain drugs, and there's definitely a discussion of continence management and falls, footwear, clean glasses, specific exercise and balance training, rehab and recovery. But for whatever reason, that ability to have clear research that goes through those factors and what can make a difference is really limited. And that means a few things. Firstly, I think the research is hard to do because of the multiple factors that lead to a fall. I think the research is hard to validate, and it means there needs to be more research. But also then, what can I look at as an architect? So I'm not going to focus on contents management or on issues that you might see from a discussion by an OT. I'm looking at what do I know about the effect the environment has on people living with dementia and relating to that in terms of falls and things that are likely to lead to falls. So we can talk a bit, and I'll mention in passing the removal of hazards. And the reason I won't go into much detail is because those things are fairly clear. They're in lots of checklists, and it usually comes down to things like identifiable pathways, removing rugs. I had a meeting with a dermatologist, and he immediately talked about removing rugs and that being the issue. These are things which in the general population people are aware of. So checklists will go through checking that doors are easy to use, looking for level surfaces, getting rid of specific trip hazards that we see as we walk around, appropriate handrails in the right places, appropriate furniture like seats at the right height, and things like tables that people might lean on that are stable, and handrails in bathrooms. These are things which you'll see in various checklists and people talk about in terms of home modification. But what I want to focus on more is beyond those hazards, how can we do things which will affect somebody living with dementia? And in a moment, I'm going to talk a bit more about dementia and how it affects people. So the three issues I'm going to come back to through this talk are our better perception of the environment is central to our function. And to me, from what I've read and from what I can correlate from that, is a key issue. And I'm again saying here, it's hard to find research, therefore it's from conversations, from my experience and from me rationally developing an understanding of the fact that if I'm somebody who is an older person with difficulty moving around and I have difficulty perceiving the place that I'm in or find it overwhelming, that's something which is going to increase my risk of a fall. So I'm going to talk about better perception, which again, Renee said I need to talk about. People need clean glasses. I was busily cleaning my glasses before this. Clean glasses are really important, but beyond that, and that's almost a metaphor, clean glasses, but a clear awareness of what's happening around us without it being overwhelming. So I'm going to come back and talk about perception shortly. Active lifestyles. So the idea of maintaining exercise, maintaining muscle conditioning, not even through particular exercises, but just through the fact that people can access outside areas. In residential aged care, it's a reality that people don't go outside, and that's a real problem. And outside is a key place where we're walking and living an active lifestyle and getting exercise. And likewise, that's going to relate to other environments. So when I did research 30 years ago, going and interviewing people who were older people who are living in a variety of environments, a key reality of their lives was it had become smaller. They were living with more and more time in one chair, in one place in their house, where they could see people coming and going. They could easily get to a bathroom and a kitchen. At that point, there were no mobile phones. People had a phone next to their table. It wasn't very active. So how can we do things that enable a more active lifestyle? And the third idea there that I'm going to touch upon is agency. Our ability to continue to live a life in which we're cooking food where we can keeps us active and moving, and that being an important reality for limiting falls. So those three things I'm going to come back to are perception of the environment, active lives, and getting outdoors. So I'm going to talk a little bit now about dementia and just and touch upon a few things where, again, I'm going to give you lots of references for you to find out more. So this page is taken from a report that was released, it was actually launched on Monday, about dementia in Australia, and I put a reference up to the web reference to that report. This is just a summary page that brings out some of the key issues. Something to be very clear of is dementia is not a single condition. It's an umbrella term for a large number of conditions. There might be 100 different diseases or conditions we talk about under that broad idea of when we say dementia. And what they share is that they'll impact on our brain function. They impact on possibly cognition, language, memory, perception. They may affect our mobility, and they'll affect our senses. And they're all disorders of the brain. They're not healthy aging. They are diseases, and the most common one is Alzheimer's, which accounts for the largest percentage. More than 50% of dementias, a diagnosis of dementia is Alzheimer's. Then the more common ones after that are frontotemporal dementia, Lewy body dementia, vascular dementia, and then it's a smaller number of other diseases, which might relate to brain injuries, certain drug use, alcohol, other problems like that. So as you can see up on these statistics, it starts to go through the amount of dementia. And from that report, it again quotes that there's somewhere in the range of 386 to 470,000 people are living with dementia. That the expectation that's the diagnosis. There may be more people, but there's an expectation that over the next 30 years, that's going to substantially increase. The leading cause of death in women and the second highest cause of death in men is dementia. It's one of the key causes of diseases that relates to disease burden. It can affect younger people. And so there's, in this report, it opens the report with talking about somebody who has a diagnosis in their 40s. By the age of 60, 1 in 12 people have dementia. By the age of 90, you can see on the screen there, it's 2 in 5. So it goes up as we get older. Once you look at residential aged care, over 50%, something like 54% of people living in residential aged care have a diagnosis of dementia. And there's a reality that many people in residential aged care who do not have a dementia, have other conditions that will affect them in a similar way. So there's the report. And I think one key thing to say about, the good news is that there's presentations by Susan Curl at the University of Sydney, which go through the fact that 1 in 3 causes of dementia are things that we can modify. So stopping smoking, being active, reducing obesity. These are all things which affect our likelihood or the time in which a dementia comes on. Henry Brodati in Sydney at one point gave a talk in which he said he wasn't looking for a cure for dementia. He was looking to put it off till somebody was older, preferably to put the onset of dementia off until beyond somebody died. So the aim was that these are things where we're trying to put off the effects and create an environment around people which actually makes the onset of dementia later. And from what we were saying before, that already has an effect on falls. So I'm just going to change the slide here now. So here we've got a slide that's talking about what the effect of dementia has on somebody is. And we're looking here at the most common symptoms will be problems with memory. It'll affect our senses and higher order skills, which is we can still learn things even if we have a dementia, but planning, organisation, problem solving, these are made more difficult. And I'm going to quote Alan Power, Doctor for Geriatrician from America, at the end of this. He presents as part of a course that we developed last year, and what he says in the trailer to that course, which I'll give you a reference to, is he says what we're trying to do is help somebody deal with what is a very tough disease and make their life a bit easier. So how can we actually support people to deal with something which is already creating a heavy burden on them and make it easier? There's a lot of commentary that talks about if we're not trying to cure a dementia, what are we trying to do? And the idea is we're trying to provide some form of care or some form of support. So a lot of the medical world is really set up around a cure model. Atul Gawande in his book, Being Mortal, talks about in America, the entire medical system is set to cure and has difficulty dealing with people aging. So the way of looking at dementia, people might talk about different stages as early, middle and late. There was a presentation given by Jane Tolman as part of the MOOC, and I'll give a reference to that as well. In the University of Tasmania run a massive online course about understanding dementia. And in her presentation in that MOOC, she talked about 3 different stages of dementia in terms of care. So in that first stage, somebody may have a diagnosis, they're probably living at home. What are we trying to do? We're trying to help maintain their independence to the extent possible. So maintain their life in an active way, in whatever way we can. As their dementia progresses, their safety or their personal safety or their need for care may grow stronger. In a second stage, what she described was people likely to be moving into some form of care. And at that point, there's this balance between how we're looking at somebody's safety and yet still helping them to live the life they can to the extent they can. So often when I'm working in residential aged care, people are saying, well, we can't let people go outside, it's dangerous. And the reality is keeping them stuck inside is dangerous because, again, that results in wasting as well as people's fear, leads to a likelihood of more falls and a shorter life. So beyond it not being a good life that you can't go outside, it's actually having negative outcomes, including in falls. The third stage is where people talk about what's the approach to care. Is comfort is a point where less relevant to falls because at this point people might be bedbound or chairbound, and that's a final stage of life. So I'm just going to, as I said, I'm going to give you a few references as we go. So if people want to know more about dementia, DTA at the beginning of COVID, when we were talking a lot about a higher number of new people entering the aged care workforce, set up a course called Dementia Discovery, which is a 2-hour online course with, I think it's 6 modules that go through 20 minutes, each different type of major type of dementia, and also looks at care plans and how we can relate to that. So that's a really good course. Dementia Essentials is another one of our courses that's run through Dementia Training Australia. It's run as a 1.5-day course, or there's online versions of it. And so that's a course you can access through our website. And as I mentioned, the University of Tasmania massive online course, Understanding Dementia, is a really solid course too. A nice image there. This could be the beginning of your journey to understand more about dementia. Okay, I'm going to now talk more about the environment and where environments come into all of this. So, as I said, other parts of Dementia Training Australia will talk about medications or supporting people who have a change in their behaviour and working with staff. What you have up on the screen next to me is a set of 10 principles that are not new. In some way, shape or form, these principles have been around for about 30 years. The first reference to this body of knowledge I've got is from South Australia in about 1986. It's an old document. It's on a typed Courier font, and it's basically saying this is what we need to do. And these principles have been developed since then, and you can see here that Mary Marshall, work by Mary Marshall, Stephen Judd, Richard Fleming, Kirsty Bennett, over the last 30 years were writing and rewriting different versions of these principles, but there's a consistency to them. And it talks about looking at risk, but making any reduction of risk unobtrusive, so it doesn't damage somebody's lifestyle. Looking at human scale, allowing people to see and be seen, and a range of other ideas there. And again, on our website, we've got our environmental resources that go through each of those in more detail and give you environmental assessment audit tools. So that's a downloadable resource that you can access from our website. The more I've looked at this and to work out why is this, the problem is that this body of knowledge, which has been around so long, is still not applied in many, or in the majority of residential aged care. It's not applied in many retirement living settings. And it's even, people can look at the same material in their homes. It's not applied very well in people's homes. So this knowledge has been around for a while, hasn't been applied. And for me, every time I looked at it, I wanted to find a way of bringing it back to key ideas that people could build their thinking around. And so the three that I keep coming back to, small households is something which has been raised again by the Royal Commission. The federal government's response in terms of funding said, yes, the Royal Commission's recommended that aged care should be provided in small scale clustered living that is residential, and has looked at putting in funding to support that. Getting outdoors. The scary reality is that I read a statistic at one point that said in residential aged care, the likelihood or the average amount of time or the median amount of time that somebody spends outdoors is about 90 seconds a day. And so that basically means people aren't going outdoors. And it could be because the building's stopping them. It could be because people are actually locking the doors, but it's a huge issue. So that's an issue that I really wanted us to address straight on. And the third one is the idea of managing stimuli, which I'm going to talk about first. Each of these has an effect on falls. As I said, one, getting outside is about exercise. The small households gives people agency, or how do we maintain a life which allows that ongoing daily life that we want. And the third one, looking at stimuli, is about how we perceive an environment and actually see hazards for ourselves. So I've put up an image here, which is about perception, orientation, managing stimuli. So I'm going to talk a little bit about each of these. The first one is these three. And perception, orientation, people talk about wayfinding. It all comes under a general cover-all title of managing stimuli. The reality of what dementia does to, what different dementias do to people, and they'll affect everybody in different ways, but the experiences that people describe are ones that do affect their senses. So Agnes Houston has wonderful videos that talks about her experience and her way of engaging and coping with her dementia. They're very solid videos. And again, we can send out references to those. The issues that people bring up are, if I've got challenges potentially with my eyesight through macular degeneration or other problems, it's compounded by a dementia, which makes my processing of the information worse. So that could be a corridor like the one over here, which is full of clutter. That's a problem. It can be something like a patterned floor here where I'm having difficulty working out what's where. It can be a busy space, like the image over on the side there, which has got a lot of noise, or just that there's not enough light in this space and there are mirrors and there's not a clear sink in this cafe for me to know what to use. So looking at that, it's creating all sorts of problems for me in terms of those issues. And I talk about noise, clutter, glare, lighting and busyness as the first things that we can affect in any place. So whether or not we're trying to set something up in terms of adjusting somebody's house to relate to a place, to make it easier for them to work with, we might be looking at getting rid of rugs, but in the same time, getting rid of clutter is going to make their life easier. It's going to make them less likely to fall. Making sure the lighting is at a higher level. Our eyes need more light as we get older, about twice as much light. If somebody wants more on this, there's a great book called Enlighten, which does go through the light levels in different situations. But it's a high level of light, as well as an ability to change that, which I'll come to later, to actually drop that level at night time. So we can affect light, we can affect noise in the same way that you might be looking around at what can I do in terms of some supports like handrails. The other questions are what can I do in terms of these sorts of issues. In the next slide, I've got an image from a drawing of a residential aged care facility. This is a drawing of a real facility. It's one based in Hunters Hill. We drew this about 5 years ago. This was a place that was quite expensive to move into, and we can see this could be many residential aged care environments. And again, my fallback is to talk about residential aged care because it's an environment in which we put the most vulnerable people. It should be the most supportive, and often it isn't. But many things I'm looking at here are just as applicable to either various forms of retirement living or people's homes. And if we look at this, what are the problems? Well, firstly, there's very little contrast there. So my eye's having a hard time seeing its way around. There aren't places for me to sit. All the doors look very similar. They all look the same. It's not a very, it's not something which I can relate to as being home-like. It's a bit institutional, and there's lots and lots of clutter. So what we looked at here was, if we just make changes to the surfaces, so if we have a consistent floor finish that runs all the way through here, it's easier for somebody to find their way around. If it's one simple surface, people will see things on it. If there's a change of tone, people often are going to see something as a change of level or a hole or something I need to bend over and pick up. So again, whether I'm looking at somebody in residential aged care or in somebody's home, it's the same stuff. If there are too many changes of level, it actually causes a real problem for people. And there's stories like in the book, Still Alice, she talks about getting to the front door of a building that she knows and thinking there's a hole there, when in actual fact it's a dark rug. So being mindful of having a consistent tone through a building, that's really important. Secondly, you can see here that whereas we've got a dark floor, we've then got very light walls here. And so those are actually contrasting it, making it easier for me to find my way around. We've provided somewhere over there for somebody to sit, and that reality that people often don't use handrails, but they do use places to sit. And if people can rest, it'll help them to deal with being able to rest before they move on. All of this is, we've also increased the light level and tried to provide wayfinding markers and hidden whatever clutter we could. And all of this is trying to make somebody's life easier and make it easier for them to deal with this debilitating disease, which is causing burden, and to take away that burden. So whatever we can do with that, that's going to help. So that's the main idea of the main take home from here is what can we do with an environment that actually pulls those issues back. There's a quote I often quote Colin Cunningham from the Dementia Centre, who talks about the experience of somebody in an environment where they want to go to the loo and they're too confused from the noise, from the busyness, from the patterning, that they can't find their way to the bathroom, and they soil themselves. Have they got incontinence, or is it environmental induced incontinence? And that's to say the environment really does matter. So the link to resources here is there's My Life, My Home is a book that is by Colin Cunningham, which is a really great little resource that talks about what people can do around their home. And there's the Enabling Environments website, which was produced by Dementia Training Australia with Alzheimer's Western Australia, or Richard Fleming working with Jason Burton. And if you go onto this website, you'll see images like this where you can click on different parts of that, and that will show you what you can do that affects lighting or other areas and other finishes. So that's an introduction to looking at perception and people finding their way around. The next thing I want to talk about is going outside. And again, I'm going to just stop for a second and ask you to think about a place that you're familiar with and what might make it easier or more difficult to go outside. So I'll just pause for a second and people can throw some comments into the chat. Okay, so people are talking about steps, heavy doors and stairs, unpaved areas, fantastic. And what you've got over here is an image of an activity card. In our team, we set up a series of 16 cards that are aimed to prompt a conversation. We're actually producing hard copies, but at the moment you can get these as a PDF. And what you're seeing here is a scene where we tried to bring a lot of that together. So we're saying, if you want people to go outside, and again, this was about residential aged care, but equally applicable to retirement living and to people getting into their own garden. So if you want to get outside here, the doors are identifiable doors. The curtains have been pulled back. Somebody's got a seat near the door and there's something to do outside. And getting outside from a falls level and from a general life level is just so fundamentally important. I mean, the reality of exercise relating to muscle tone, vitamin D from sunlight, it being good for our sleep and our circadian rhythms, that actual relationship to daylight and to light, to me, it's something which seems obvious, but it's really failing, at least in residential aged care. And from what I saw in people's homes, as somebody gets older, as people have a diagnosis of dementia, it actually becomes harder. And these are the burdens that, from what Alan Powell was talking about, we need to remove. These are the things that we can affect change to. So I'm just going to flick through things that we can do, many of which are encapsulated in this slide here. So firstly, this is a scene from an area outside a community hub as part of residential aged care, but something was open to the community. And they wanted somewhere that got people outdoors. And it was literally about creating a clear space just outside, which had an umbrella and, here's a contained spot. Here's something that you can actually go and do. Somewhere you can go. And the little diagrams down the bottom are each trying to say, well, the first thing is somewhere to go. The second image is, let me just go, not that one. Second image is from here. It's the fact that you can see the outside. So that from inside, from a communal area, you're looking through beyond other lounge spaces and you can actually see the courtyard. You can see where you might want to go. So in residential aged care, it's about both residents and staff being able to see it. In somebody's home, it's just the fact that it's easy to get to gardens because you can see where they are and you're reminded to go there. This is a Winteringham building. It's a residential aged care, but it reads a lot like a retirement village in terms of everybody's got their own little unit opening onto a balcony here. And so the fact that there's a shaded edge to a building, that really helps people being able to get outside. It means that people, their eyes can adjust, but also maybe I'm just taking a step outside my door and that's a spot that I can sit and stay. A third building here, this is from a building in America, and this is about the importance of a clear path. And the same way we talked about, I talked about spaces indoors that have a consistent tone through a pathway, where that tone can continue out into a garden is important. There's a lot of concrete here, a bit too much for me, and I don't really like that little structure in the middle, but I'm looking here at the paths and the fact that there's clarity here that you've got this clear, identifiable path where it's light, the plants on either side are dark, I can see my way around. There's no big drop off on the edge of the path. I'm not worried about falling. And if I'm in a care environment, the staff aren't worried that I'm going to fall over the edge from tripping. So that importance of a path, which is, yes, removing obstacles and looking for something which is going to be level where possible. But beyond that, what can we do to make it really stand out that that's the path? And the final idea I'm going to put here is it's from a Hammond Care building in Sydney. And it's the idea that where possible, if we can create an environment in which somebody can go through a series of experiences, they step out their door, there's a spot like this. They go out somewhere into the garden, there's something else that they can actually do, somewhere they can go. Then the idea of, dementia equals wandering is out the window because somebody goes somewhere and does something which is meaningful to them, and maybe that leads on to another experience, and that sequence becomes a really healthy environment. So we've talked about perception, and we've talked a little bit about getting outdoors and the importance of that. The last section I'm going to talk about is about small scale living. And I've got two images here. This is an image from a building which is both retirement living and residential aged care, and this real importance of them actually providing people with places that they could go outside and do work that related to pot plants. And the second image I've got here is a kitchen for a residential aged care facility we recently worked on, where when I was there last time, there was a beautiful engagement between a resident sitting there and the staff member making food in front of them. And I just want to put these two in here to say, if we're talking about perception and finding our way around as a key to knowing an environment, seeing it, being comfortable in it, and that supporting us not having a fall, if the second thing we can talk about is how we actually get outside and can exercise, the third thing I'm talking about here is how can we actually create a world in which somebody can continue to be active and continue to retain that sense of agency, that they can do things, that they can keep doing things for themselves and retain abilities, even though they're dealing with the burden of this really tough disease. I'm just going to summarise what we've gone through and go through that. I can talk about those more, and there's a lot that we talk about to do with small scale environments. There's a bit of a plug here as I wrap up for 3 things that we do, one of which is there is an online course that's a free open course that we set up that goes in more detail through how environments can be supportive. It takes about 3 or 4 hours to do, and it's accessible through our website. We have those activity cards that people can also access. Also, we do series of webinars that talk through different issues, and the next lot of webinars are going to talk a lot more about home modifications and are going to talk about different retirement living in different environments, as well as we run a program where if you're in residential aged care, we do work that goes through training and consultation about a particular building and what you can do to achieve some of what I've been talking about. So just going through that again, the levels of intervention to prevent falls beyond supplements and other health management are about removing hazards like getting rid of objects along a path, but also looking for the barriers created by noise, glare, clutter that affect people's function. Then supporting people getting outside, as well as those daily routines. And I want to just finish off by talking a little bit about dignity of risk and what people talk about. In terms of the aged care standards, are very clear about the fact that restraints are a problem. Locking people indoors is a form of restraint. Preventing access to gardens is a form of restraint. So what can we do to keep somebody's life rich? And for me, when I wanted to think through now, finishing up, it's more about what can each person do in terms of how they're related to the different role. I know some people there do work in residential aged care, some work in the community, or other people might have other roles. And we live in a world that has demonized dementia. So in Harry Potter books, when they talk about the worst possible thing, they're talking about dementors as a terrible life. And that's permeated all elements of our culture, that negative approach to dementia. Sorry, I've just got a bit of a scratchy throat. That's permeated everything and something we need to change. Kate Swaffer, who's one of the strong leading advocate for somebody living with dementia, says that when she got a diagnosis of dementia many years ago, she was told, as a young person, she was told, well, you've got dementia, get your end of life affairs in order, and now look at somewhere you can move into residential aged care or something like that. She was 20 years younger than the average age of people moving to residential aged care. She's not living in a care environment at the moment, hasn't needed to, but she had this big discrimination that she had to deal with related to that. So if you're care staff, we're looking at how can you remake environments by removing clutter each day, opening doors up to environments, supporting ongoing life activity. If you're looking at home-based support, I recommend that book, My Life, My Home, which was one that involved Agnes Houston working with the Dementia Centre as somebody who's had to deal with this stuff firsthand. If you're a designer, the vast majority of residential aged care, including new buildings being built today, do not reflect that knowledge base I've been talking about. The resources are there. If you need more, come to us. We can lead you through what you need to do and your own training. And that key thing that Alan Power talked about that you'll see in the trailer for the course I've got up here, in which he says what we are doing is building an infrastructure for more reserve and more resilience for a person who has to live in a tough situation with a tough disease. I hope that's been of help. So I think now, Apple, you've been taking any questions in Q&A. Are there any things which have come up that you want me to run through in the last 5 minutes?
Yeah, so there are a couple that came through in the chat box. I'm just gonna have my slides up. Sorry, give me 2 seconds. Yes, if there's any questions that you guys want to ask, please use the Q&A box and we can hopefully get to you. But we have a few already. So there's one that came through earlier on that said, could you please elaborate on design principle number 2, provide a human scale, and
Absolutely.
what this entails?
Okay, so firstly, those slides are going to be available to people. So I'll be sending those through to you, Apple, to distribute further. Yep. And the references, I'll send through a full set of references to what I've talked through there, including where you can find those design principles. Small scale ties into, in the world of residential aged care, many environments have been built and are still built as large institutional spaces. So I don't have a meal with 50 other people. I definitely don't have 3 meals a day. I don't have a meal with 50 other people often at all. And so if we're looking at somebody who's already dealing with the burden of dementia, we're talking about how can we bring that scale down? How can we reduce the number of people? How can we reduce the size of a space? And the classic thing people talk about is how can we have small scale living models? So the models which are seen as being supportive are either somebody staying in their family home, somebody moving to some form of a group of apartments or a group of some sort of supportive apartments. That's been done a lot overseas by people like the Schlegel Group, and I don't think it's been done much in Australia. We do retirement living, but how we can then take that as a model of somebody getting out of their own essentially family home. When we talk about group homes or group living, something like Group Homes Australia by Tamar Krebs does do things in groups of 10 people. Many other providers are looking at, can we get the number down to under 15? So Susan Dyer's report a couple of years ago of looking at the benefits, and it talked about a reduction in hospitalisation and better health outcomes of smaller groups, said groups of under 15. So aged care broken into smaller groups of under 15, but also the spaces being smaller scale. So rather than being, I'm in a big hall with lots of people, I've got access to smaller spaces where I can function better. If I've got problems with my hearing, I'll actually have less noise. If my dementia makes my hearing or my eyesight worse, there's less distractions. So when I talk about small scale, I'm talking about the number of people, and I'm also talking about the size of the space. And that has a series of flow-on effects, but it's one of the most significant things that we can do. A lot of our work at the moment, I don't think that most of residential aged care is going to be knocked down and replaced. So a lot of our work is about taking buildings which are institutional, and this is my architectural work, and actually breaking it down to smaller households. So we did work recently that took a 100-person facility where people were in larger groups of 50 and broke it down to a series of smaller households.
Okay, thank you. A second question was, are there any particular design principles that are more important or require more focus on older adults living independently in the community?
Okay, so what I've tried to do is I'd look through the design principles because they really are the backbone to what we do. I've tried to distill those down to those 3 objectives as a way of engaging with many design principles. So each of those objectives is relating to more than one principle. Managing stimuli, in the principles it talks about removing or reducing unwanted stimuli and then reinforcing useful stimuli. And I'm looking at as, let's think broadly about how do we make a space easier to focus in terms of, in a home-like environment, how can we reduce noise? How can we make it easier for people to have a quiet conversation? How can we make it easier to find your way around? And that same way you look for obstacles in terms of objects around the space, how can we find a way of making sure that there's a consistent tone? So there's no rugs, but also, if possible, the floor finish is the same tone all the way through. And so that brings together 2 of the principles. And when we start looking about going outside, it's not one particular principle. There's one that says support movement, but it's a wider range of principles that says going outside is fundamentally important. Whether I'm living at home, whether I'm in a retirement setting, or whether I'm living in some sort of care home, in a clustered living or group home environment. And so it's important, how do we get outside? And so each of those relates to several principles. As I said, the resources like enabling environments or the home book that I mentioned are ones which relate to home environments. Many of the resources relate specifically to care environments, and then somewhere in between those 2, we're looking at other forms of accommodation.
Amazing, thank you. I'll just pick the last question so that we can wrap up. Do you have any advice for case managers or home care providers in having the conversation with family caregivers about implementing these design recommendations?
Okay, look, that's a really big challenge because, for instance, to me, it seems a straightforward thing that you would put a tablecloth on a table and that's part of having a home-like environment. And I know of situations where family members are worried that that's unsafe. There are many resources out there, many supports that you can rely upon for case management in particular situations. So Dementia Services Australia looks at dealing with individuals with in situations where the staff are challenged by engaging with an individual. And I think that would be a starting point for how you actually talk to families, would be talking to them about the fact that there's a base for doing this work for the particular individual. We give general training rather than case management of a particular situation. And so I'd be saying that's about you looking at the situation and finding a way to engage with the family for them to realise that there's no value to preserving somebody in a state that actually reduces their ability, reduces their agency, limits their ability to go outside, and limits their life to make it that much less rich and that much less desirable. And so it really is about how can you get into that space for the family members to understand that this is so important to the person who you're working with.
Yeah, I think that's a big challenge, but yeah, thank you. So I'll just kind of move on to wrapping up. I'm aware of the time. So there's a few resources I've put together as well, and we'll share all these links with you in a follow-up email to all registered participants. So these are, some of the resources that I think are pretty helpful. Is one of the Dementia Training Australia's video resource by Alyssa Burton. She did a presentation on falls and dementia, which was published last year. And if you want to access this video and loads of other educational videos about dementia, please feel free to join the Dementia Training Australia community. It is free of charge, and all you have to do is sign up to access the resources. Alyssa Burton is also has a couple of research projects going on at the moment, and she's recruiting for them right now. So there's a home-based walking aid training program, which is on the left. There's a flyer there, where she's looking for people with dementia to participate in this study. The recruitment for that ends in November. And there's also a Balance on the Brain program, which is recruiting for another couple of years and is looking for people aged 50 years and over living in Perth, WA, who have been diagnosed with mild cognitive impairment. So please contact Alyssa Burton if you are interested in participating or know someone who is interested in getting involved. As it is Dementia Action Week, Dementia Australia has a few resources available on their website. There's plenty of resources for health professionals to use and help raise awareness of dementia. This particular article explores some of the themes discussed today, such as the 7 tips for health professionals to make care settings and unfamiliar spaces more comfortable for people living with dementia. Some of our upcoming events at Injury Matters. We have in October our National Nutrition Week, and Appetite for Change, Preventing Falls in Older Adults, which will be looking at the role of nutrition in falls prevention. In November, leading into summer, we also have a heat injury among young children webinar, which will be looking at KidSafe WA and the Department of Fire and Safety, and we will be discussing risk mitigation strategies for heat injury. On the 30th of November, we also have the Australia-New Zealand conference, Australia-New Zealand Falls Prevention Pre-Conference event. There are so many more events coming up. So if you're interested in any of these, please check out our website and register your interest using the events tab on our website. We have our Stand Your Feet, Improve Your Health campaign running right now, going from September through to November. Some of the key messages the campaign aims to get across is to keep a healthy mind, check your medicines, and fuel your body, as they are key areas to look out for to prevent falls within older people. So get involved by using our campaign toolkit, which has a whole host of resources you can use in your workplace to promote healthy aging. And finally, just to keep the conversation going, please join our Community Falls Network. The Community Falls Network meets quarterly to provide professionals such as yourselves working in the falls prevention space across WA with an opportunity to connect with each other to share learnings and solutions in falls prevention. We encourage you to reach out to us if you're interested in joining the Community Falls Network. Our next meeting is on the 19th of November. We also have Connected. Connected is an online networking program for professionals working in the injury prevention space. It is a networking program where participants are randomly paired bi-monthly to have a 15-minute conversation with another professional working in the injury prevention space. Connected takes the hassle out of networking and provides you with an opportunity to connect and share your knowledge and skills with the injury prevention sector. Just use the link on your screen right now or the QR code by simply opening up your camera on your phone, hover the camera over the QR code, and you should be able to be redirected to the link on our website to register. We'd also love to hear your feedback about what you thought about today's webinar training. When this webinar ends, you will find a screen pop up with a short feedback survey that will not take long at all. It is a very short survey that we'd love you to complete. And if you complete it, you will receive a certificate of participation that you can use to prove that you have attended today's training. We really value your feedback, and it helps us to ensure we're delivering falls prevention trainings that meet your needs. So that's it for today. Thank you again, Nick. I hope you all have a wonderful rest of the day, and yeah, have a good week.